Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I'm your host, Dr. John Hausman. Today, we're previewing ACR Convergence 2025, coming to Chicago this October. And our guide to the program is none other than Dr. Greg Gardner, chair of the annual meeting planning committee. Two big topics that will run through the conference: emerging therapies and artificial intelligence. These are threads that you'll hear running from the opening session through the debates, the basic and clinical research conferences, and the FDA forum. We'll also dig into what's new, the Practice Innovation Summit, a pre-course focused on the business of rheumatology, plus the always packed Ultrasound Course, the Fellows in Training program, and why this year's meeting is a touch earlier on the calendar. We'll also talk about active learning, how the Quilt group is coaching speakers and building reflection into sessions, and the possible use of audience response system right in the meeting app. And we'll preview some of the highlights of the meeting, including CAR T-cell therapies, the new non-renal lupus guidelines, and a live journal club with editors session that will address big data papers. And we'll talk about the keynote speaker, Dr. Tate Shanafelt, who's going to speak about clinician well-being and burnout. Dr. Gardner is currently Emeritus Professor of Medicine at the University of Washington, where he previously held the prestigious Bruce Gilliand and Lucille Henderson Endowed Professorship in Medicine. He previously served as Clinical Director of the Division of Rheumatology and as Fellowship Program Director. He's widely recognized for his excellence in teaching. He's been a champion for underserved communities and has improved our understanding and the care of patients with autoimmune lung diseases. Enjoy. Greg, welcome back to the show.
Oh, glad to be here. Thanks for the invitation, John.
Super excited to always speak about Convergence. This is Convergence 2025 happening in Chicago. Is there a particular theme this year's Convergence, Greg?
Well, I think if we thought of a theme, it's probably emerging therapies and probably AI.
Ooh.
Are the two things that come to mind.
Love it. I'm actually planning one of those AI sessions myself.
I know that, and you're moderating.
Yeah, there was so many interesting sessions as I was reading the program, and we'll talk a little bit more about that. But before we get started, the process of planning for Convergence 2025 starts right after you finish Convergence 2024. Can you tell us a little bit about sort of how you think that conference went, what you really liked and what you want to try to do again, and things that you may want to change from last year's conference to this year's?
Yeah, you're exactly right. So it's just a few weeks after Convergence 2024, we started planning for 2025. And the real planning season is December to about February. And then it's making sure those sessions come to life. And the AMPC staff is amazing. I mean, they take our ideas and make them happen. It's a pretty amazing process to witness. But anyway, the things that I think worked well last year were we brought back the MTPs. Those were very successful. Had about a 90%.
Meet the professor sessions, right?
Yeah, 90% fill rate.
Wow.
We're going to have that again this year, but probably won't expand it. We'll probably keep it the same level and see how that goes. We had networking lounges again last year. Those were very successful. And this year we have networking rooms as opposed to lounges. And we'll keep those. And those are almost filled. Well, there's a few slots left in case anybody has a group they want to meet at ACR Convergence. Let us know. We can probably accommodate a few additional groups to meet in those networking spaces. We also had last year, we had an active learning room. One of my interests as the AMPC chair is increasing what I call the maximize information transfer. How do we get the most information into people's brains and into their practices and to whatever they do? So we're trying to be more cognizant about our quality of learning and teaching. And we can talk about that a little bit more in a few minutes, if you'd like. So that worked really well. We're going to do that again this year. We actually have two rooms that are set up as active learning rooms. They're rooms with round tables. And so you can interact with your colleagues and also with the speaker. And it's educator groups utilize these rooms so well. Educators know how to do that and how to interact with one another. And they use a lot of those rooms. We're using them for other sessions as well this year.
Great. And one big change that is happening is the timing of the conference. Last year it was in DC a couple of weeks after the 2024 election. So it was in mid-November. And now ACR Convergence 2025 is moving to October. Why the change?
As I've gotten involved in the planning of Convergence, you realize how far ahead you have to think about these meetings. I mean, they're planning meetings down to mid 2030s. So you have to plan ahead about 7 or 8 years in order to get space large enough for the group that attends Convergence. So I'm assuming they wanted to go to Chicago 10 years ago, and they realized that the only time that was available because of other obligations at the McCormick Place Convention Center was in that October date. I think in the future, they're trying really hard to make it into that November space that we normally have. But this year is unique just because the space is only available in Chicago during this period of time, close to that November date, but not quite at the same time that we normally have it.
Got it. Okay, that makes sense. So it's not something that is going to move forward doing October dates from now on. It's still going to be in November. It was just sort of a one-off to make sure that we get our conference in Chicago this year.
There may be some, mild changes depending on the area that we have the conference and the dates that are available. But in general, it'll be that November space we normally have. But there may be some other one-time changes just because of space availability.
Great. Let's talk a little bit about sort of teaching and learning. I remember my first Convergence meeting. It was also in Chicago, maybe a little bit more than a decade ago. And I attended, I think, almost every session that I could. And I got home and, after 5 days, like 9 to 5, and my wife asked me what I had learned. And I really didn't have much to say, right? Even though I had listened to a lot of sections, I didn't really sort of internalize much of that information. And I think that's one of the sort of dangers of, large conferences like this, that, just by sitting in the audience doesn't mean that you will actually retain the information and be able to use it when you go back to the office. So I know, as you mentioned, you're really interested in medical education. How are you envisioning that, that attendees really learn from this experience? Certainly the speakers are going to be teaching, but how can you, make it easier for attendees to actually learn?
Yeah, let's talk about the Quilt Group. When I became chair, we initiated this group called the Quilt Group. They came up with that name themselves. I thought it was pretty clever. It stands for Quality Improvement in Learning and Teaching.
Hmm.
And the interest has been in an active learning. And active learning, as you know, as an educator, is the way of teaching that fosters reflection on what you do. And the data on CME over the last few years is if you can get the audience to be reflective on what they're listening to, they internalize it much better. And it sticks. I remember one year going to a meeting and I made it a point of writing down the 2 or 3 things I took away from each session. I remember that for months and months and years afterwards. So we're trying to help the speakers learn how to do that, be more active learning focused. And to that end, the Quilt Group had some ideas and they just come up with some amazing things to help the meeting maximize information transfer. I got to give a shout out to Jay Mehta and Kirsten Coons and Andrew Vreede and Julia Shalin. They actually have developed this program where they actually have speakers connected with a coach. They recruited some of their colleagues from the Educators Forum. And last year, the number of requests for coaching exceeded the supply of coaches. So
Wow.
I think there was like 41 or 50 speakers that were coached about active learning, having an educator go over your slides and your presentation. And so they've also added some information to the speaker's site that also talks about how to engage an audience. And they'll also have closer to meeting office hours for speakers who don't think they need a coach, but just want some tips on how to be more active in terms of engaging the audience. The other thing that, the app last year was much better than the year before. As you know,
Yeah.
it was much improved. And the app company is pretty good. And we'll have the same company this year. And what's interesting is they actually may be able to build in an ARS system, audience response system, into the app.
Awesome.
So we're going to explore that in a meeting up in a couple of weeks. So another way to engage the audience is through polls and questions, and again, helping people be more reflective on what they're listening to and hopefully internalize that information a little bit better. So I'm not promising anything about the ARS, but that's the goal for 2025 is to have an app with an ARS system built in.
Yep. And I think that goes both ways. Certainly teaching the teacher about these active learning techniques and also teaching the students, the learners about, how we should be acting when we're sitting in a conference room. And, I love what you mentioned about reflection, right? So reflection at the end of the lecture, thinking about what did I learn? Why is that important? How can I apply that to, my practice, my patients? And, what questions has this raised for me, right? What am I still wondering about? I think they've done some research that just by, learners asking themselves those questions at the end of a lecture actually, increases, retention for that material and, that ability to transfer that information when you're out seeing patients. So, I love that you're thinking about it and that, the speakers are going to be coached in how to enhance that aspect of active learning throughout the conference.
The post session evaluation, if we can find a way of getting it in front of people a little bit better, actually does that. So it says, what are the 2 or 3 things you took away from this session? In addition to, would you listen to this speaker again? And, those sort of things. But so we try to make it a little bit more, again, active learning focused and even the assessment piece.
Awesome. So the Convergence officially starts Saturday, October 25th, with the opening sessions at 4 p.m. And as always, there's usually some advanced programming that happens before that. And for the first time, I saw there's something called Practice Innovation Summit that starts on Friday, October 24th. What is that?
So you're probably too young to remember, John. I'm an old guy. In the old days of what we now call Convergence, there was a coding course and some other
Mm,
things that were focused on sort of the business of medicine and rheumatology. So the CORC committee, Committee on Rheumatologic Care, posed that we add something similar back as a pre-course. So the Practice Innovation Summit really is focused on the business of rheumatology, enhancing what you do in the office, especially focusing on private practice rheumatologists and rheumatology health professionals. And it's going to be on Friday and Saturday. So that's 2 half days.
amazing.
It'll be an extra cost this year. So it'll be an add-on. But I think it's exciting. We'll see if that draws more domestic rheumatologists into to the Convergence sphere. And hopefully there'll be value added for those people who want that extra. We've always had business of room sessions, but this is sort of a really focused business of rheumatology experience for people who want that.
Awesome. One of the other things that is coming back is the Ultrasound Conference. It's also a 2-day conference, I believe, and there's also an added cost to that, right?
Right. That's fairly expensive to put on, as you can imagine. And it's always well attended. In fact, there's a waiting list for it. And so there'll be a basic and an intermediate and advanced sessions. And it's a 2-day experience as well. Always well received and well attended. And the Committee on Education organizes that sort of separate from what the AMPC does. They always do a great job. It's going to be a wonderful experience this year as well.
Amazing. And we've certainly had ultrasound providers here at ACR on air that have discussed sort of, the path to certification and how useful, ultrasound is in their practice. And it's great that, this conference is available for people that are interested in, either perfecting their skills or getting started with the ultrasound.
I remember when ultrasound first came available to rheumatology, I thought, well, I've been doing this for 20, 25 years. I'm pretty good at it. But I realized how much ultrasound really enhanced what I did in rheumatology practice.
Amazing. I was happy to see that the Global Summit is back. It's been a couple of years that has been happening. And, I've been listening in because that's always done virtually because there's people all over the world that participate. But I was happy to see that that's back.
That's actually, if you buy the all access pass, that's available to you and will be available on demand to you as well, which actually I have enjoyed watching some of those sessions after the conference if I've not been able to tune in during the conference. That's really put on by the Committee on Global Engagement. And they always do a great job of thinking about sort of international topics important to rheumatology care. And that's no different this year. I mean, they've really done a nice job of organizing that. And it's been going on for a few years and it's back this year as well. And it's been well received and it is the only virtual component of the meeting.
Right. Everything else is in person. And then on Friday at noon is the Fellows in Training program, which I remember attending as a fellow was always a lot of fun and opportunities to network with other fellows from across the country. That's such a great experience.
Yeah, that's put on by the Committee on Training, and it's a long-running program. In fact, I went to even when I was a fellow back in the mid-'80s, they had something similar, and,
Wow.
they put us out at a roommate from UNLV, and they had special topics for us, and that's true this year. And plus they have roundtables with experienced rheumatologists. You get to meet some of those people, and there's a reception afterwards, so you
Mm,
can interact with some of your colleagues from around the country. It's a great program, and I'm glad that the Committee on Training has continued that aspect of convergence.
great. Yeah. Moving on to Saturday, I think one of the most popular sessions probably of conference is the review course, which I guess similar to last year, that's sort of like a half day starting from 7:30 to 1. But this year I was really blown away by all the really cool and interesting sessions on everything from inflammatory brain disease, myositis mimics, updates in gout, vasculitis. Seems pretty cool.
Yeah, Julie Pack and Sarah Baevsky has done a nice job of putting together the review course and making it very timely. And you're right, it's always a hit. And it's also included in the all access pass. At one time, it was an add on, I remember.
Yeah.
But the last few years, it's been part of the all access pass, and you can go to it and watch it on demand later if you want. And great sessions as always. It's also, we're hoping that people who come to that Practice Innovation Summit will go to the review course, so we try to build that in, give them some time because the practice innovation course begins in the afternoon on Saturday, the second part. And so people have time to go to the U course if they'd like.
Very well organized, Greg. Thought about everything. And then the other couple of things just to mention is the basic and clinical research conference that, usually happens, I think at the same time as the review course for scientists and researchers to sort of learn more about, scientific techniques and whatnot.
Yeah, this year is pretty exciting. So they're going to spend some time talking about immune checkpoint inhibitor, IRAEs, and how we as rheumatologists have to address that. Well, they're also going to spend some time talking about what I'm excited about, although it hasn't been used extensively in rheumatology yet, is some of the new CAR therapies
Mm,
and also cytokine modulation. Oncology has been using these techniques for years, and we're just now beginning to utilize them in rheumatology. And that's, I think, some of the excitement is in terms of you can reset the immune system in a lot of these patients, at least the not a huge number of patients who've been treated with these therapies so far with autoimmune disease, but the ones that have been treated, they've had this amazing long-term immune reset by using these therapies. It's not cheap, it's not readily available, but like a lot of technologies, it's going to get easier to do.
yeah, I think there are several sessions throughout the conference about sort of CAR T cells and using, as you mentioned, leveraging the immune system to try to cure people of rheumatic diseases. Who would have thought?
And the basic science conference will utilize colleagues from oncology as well that have a lot of experience in these areas already and can sort of share with us what they know. And it's pretty exciting.
Amazing.
Good time to be a rheumatologist, right, John?
Yep. And then just to mention the last thing that happens on Saturday before the opening session is the radiology boot camp. Can you talk a little bit about sort of what that is and who that's geared for?
Yeah, so it's actually organized by the Association of Rheumatology Professionals. They do that every year, and this year they've got I think 3 major sessions on imaging of crystalline disease. They've also have a session on imaging of vasculitis, and I'm forgetting the third one, but anyway, so they do a really good job, and for those who attend the review course and want something else to do afterwards before the opening session, they can go to the radiology boot camp. It'll be great. It's geared a little bit towards the ARP community,
Hmm.
but, it'd be great sessions for physicians, DOs. It'll be a wonderful experience. If you don't want to go to the Field Museum in Chicago, you can go to the radiology boot camp before the opening session.
You can practice your observational skills in both places, just looking at different things.
I can tell you a real quick experience. So when I was in London several years ago, I went to the Museum of Natural History, and I realized looking at all the dinosaurs didn't have patella.
Huh?
So maybe that's why they went extinct. They couldn't get off the couch after a while. They couldn't get off the couch.
Great. And then it's the opening sessions. We have all the awards of people that have done just amazing things within rheumatology. And then there's a keynote speaker. Do you know who it is? Can you share some information about this?
I do know who it is. I actually emailed Carol Langford last night late, and she responded pretty quickly. So it's Tate Shanafelt, who's a practicing hematologist and chief wellness officer at Stanford University. And he's internationally known for and thought leader on healthcare professional well-being, burnout, and an impact that has on the quality of patient care.
Wow.
So a very timely, important topic for all of us who are in busy practices, labs, whatever we do, how do we avoid having it overwhelm us a bit? So I think it's going to be a great keynote.
That's awesome. That sounds, like you said, very timely and apropos to the environment that we're all living in. And then, certainly the networking event right afterwards, which is always fun and a great place to chat with others. And then on Sunday, sort of the regular programming starts. Are there any particular sessions, Greg, that you're very excited about?
This podcast only goes for an hour, right?
Yes, unfortunately.
So let me tell you a few things that, again, I'm really excited about. The CAR T sessions,
Yep.
both from basic science, from peds, and from adult rheumatology. There's 4 of them actually on Sunday.
Wow.
And the FDA session on Tuesday will also deal with the regulatory issues of CAR T and bispecific therapy as well. So, a lot of attention is being paid to this new emerging technology that may have profound impact as we go along for our patients with more severe, at this point, rheumatologic disease.
Yep.
On Sunday, there'll also be the non-renal SLE guidelines be presented. Last year, we had the renal guidelines presented, and that was a hugely popular session. This one, I'm sure, will be very well attended as well and discussed.
Yeah, we had Dr. Samaritano here talk about those guidelines, and I'm sure during this week you'll be able to listen to that podcast as well.
Oh, great. Okay, looking forward to that. Yeah. She's on the committee that crafts these guidelines and does a nice job of presenting them as well. We always have the year in review, which is always great. And we have a session on Monday on GLP-1 and OA, also timely. It says, should rheumatologists be giving them to everybody? And on Monday, we're going to try something a little bit new. So in the past, we had the session called Editor's Choice, where the editors of A&R and Annals of Rheumatic Disease would pick 4 papers they thought were really key that rheumatologists be aware of. These are recently published or soon to be published papers. This year, we're changing it up a little bit. Lou Bridges, the new A&R editor, and Peggy Crow, who's associate editor for Annals of Rheumatic Diseases. We're going to do a journal club.
Oh,
editor.
sweet.
And it's going to be in one of the interactive rooms. They're going to present only 2 papers. So the theme is going to be big data and how does it help us predict outcomes of patients?
Wow.
So they have 2 papers, one recently published, one in press that deals with some of the big data issues and trajectories of patient outcomes. They're going to dissect those papers, discuss them, have a panel discussion, open it up to the audience. So it's going to be a lot of fun. I'm anxious to see what they come up with and how this format works for a journal club during a major meeting.
Do you know if people in the audience will get access to those journal articles before the session, or we're going to learn about them during the session?
As it turns out, I'm the coordinator for that session. And I'll make sure, I've already thought about that as a great set, John. We need to make sure that people have access to those papers before. One of them's in press. Hopefully it'll be available before the meeting. I'm sure it probably will be. But I'll make sure that there's a way that we post those so that people have access to those papers.
Amazing.
And then there's always the Knowledge Bowl, which is great. There's a great lineup of memorial speakers, including George Sokas, Michael Weinblatt, Richard Lozier, John Stone, Michael Brenner, Sean Jackson. These are all great sessions of people who we think are not only great speakers, but have some great contributions to share with the rheumatology audience. And then there's the plenaries. As ACR chair and leadership, we get together and we choose a plenary, and it's really the best of the best science. So I encourage people to, if you don't go to all three of them, at least go to one to hear what the new science is telling us and what direction we may be going in the future.
Amazing. All those sessions sound really exciting. I'm also looking forward to the Knowledge Bowl. I help to train my hospital's team. So we do sort of a mock session prior to that. That's why I take full credit for why they've done so well recently. But
well, you should.
I was looking at the Great Debate. It's like, what is the Great Debate this year? But I saw there are 3 great debates this year, which is awesome. One is the Great AI Debate with Januz Yazdani and Jeff Curtis debating, whether AI is a good thing or a bad thing. That sounds super interesting.
Well, whatever the decision is, AI is still going to happen. So
yes, exactly.
well, I'm anxious to hear that discussion as well. I mean, what's good and what's bad, and where are we going with it?
Yeah. And then, I think it used to be that all the great debates were in adults. And I think last year, a couple of years ago, pediatric great debate started. So this year, very apropos topic is steroids in pediatric lupus, which is interesting. In the adult world, we're certainly trying to cut down the amount of steroids we use for patients. And, that sometimes gets carried over to pediatrics, sometimes not. So it should be interesting.
Yes, Susan Shenoy and her team on the AMPC pediatric team done a great job. And they actually have some very interesting sessions, including this one, Great Debate in Pediatrics. They also have this really cool Kahoot session. It's sort of a knowledge bowl for pediatricians. They've actually become masters of using Kahoot for that session. And I went last year, it's a blast.
It's so much fun. Yep.
Yeah. But the other great debate in adults is on ultrasound versus biopsy in GCA. We've had several GCA great debates recently. I think this one is very interesting. Is it time to adopt ultrasound as the gold standard as opposed to biopsy?
Super interesting.
Hopefully that will be resolved for us.
Yes, I'm sure. Right? I'm sure there'll be a clear winner from that one. That sounds really interesting. And, one of the highlights, I think, for me, one of the many highlights of Convergence are the poster sessions. Sometimes it's a little bit overwhelming. I don't know if you have any tips about how to navigate those poster sessions, because, there are so many, and throughout 3 different days, how should we tackle the poster sessions?
Yeah, with almost, 3,000 abstracts being presented, so that poster or oral. Yeah, you're right. It can be hugely overwhelming. So my tip is to go by topic. What areas do you need to learn more about? What areas are you interested in? You have a focus in your practice. Go to those sessions first, and then maybe wander someplace else to see what's happening. But you're at the point now that you have to choose the poster session subcategory you want to go to, just because there's so much.
Yeah.
I remember in the old days, I used to, after the poster sessions and the hall was pretty much empty, I would just wander around the posters and just sort of see what was going on. I learned a lot by doing that.
Yep.
But that's becoming difficult because there's so many posters these days. The other thing you do is you can join a poster tour.
Yeah.
Have a master or somebody knowledgeable in the area take you around and show you some of the key issues. Well, I know the app will allow you to plan your meeting experience, but do take some time before the meeting or the morning of the meeting to sit down for a few minutes and decide what's most important for me to see. They're online, so you can see all of the posters. You want to read them. But if you really want to interact with the presenters, be specific on what you want to go see.
Great. Any other tips for, fellows or first-time attendees to this meeting? You mentioned sort of making a plan, before the meeting or at the meeting about, sort of the posters or the sessions you want to attend? Any other tips? Because it's
Yeah,
always so overwhelming.
it is. And so my big tip is number one, don't try to do too much, right? I remember as a new fellow, I was just everywhere. I was exhausted by the end of the day and I wanted to see everything I could. But now with on demand, you can be very picky about what you see and then see whatever you would have liked to have seen but didn't get a chance to via on demand later on. And plus the posters are all online as well, the abstracts. So be selective, plan your meeting experience, as I mentioned. I recommend you go to year in review. If you're a new fellow, go to at least one plenary session, as I mentioned earlier. Choose the topics that interest you. Go to at least one memorial lecture by one of the leading people in the area that they're speaking on. Go to one networking session
Hmm.
so you can meet some of these, people who are moving the field of rheumatology forward, see how they do it, and so that you can become the next person that moves rheumatology forward. But also take some time to enjoy Chicago. I mean, it's an amazing city. There's lots of things to do there. If you all work and no play, it can be a little overwhelming. So I have a memorable experience with Chicago as well. I'm not much of a foodie, so I can't actually recommend any restaurants in Chicago
Hmm.
beyond, the McDonald's or whatever. But I do love art, and, the Art Institute of Chicago is incredible. So if you have one thing to do and you have my interest of art, go to the Art Institute of Chicago. There's so much impressionism there. And, there's lots of Renoirs. And as rheumatologists, we have to love Renoir, right? So yeah, go do
he
something
he
fun.
he had RA, right? Is that right?
Yeah, severe RA. Yeah.
Hmm. Amazing. So let's unpack that a little bit. You mentioned sort of the on demand. So is every session going to be recorded and is it going to be broadcasted live or what's the deal with video this year?
Yeah. So on demand will usually available within 48 hours, maybe 48 to 72 hours. So it'll be available to you pretty quickly after the meeting. And if you look at on demand use, it's very heavy for the first 3 months. It sort of tapers off after that.
Sure.
So, I mean, it's a great tool. And actually, if you're interested in getting CME credit or MOC credit, that's a great way of increasing the amount of
Mm.
MOC is CME credit you can get is by watching on-demand sessions. And what I love about the on-demand is, as opposed to a live session, you can't stop them. And I can stop them. I can look up a reference if I don't understand exactly what a bispecific antibody looks like. I can ask open source or whatever it's called, open access. So
Open evidence.
open evidence. Thank you. The medical AI that helps figure out some of the things that I need to know. And so it's a great tool, and it's available for those who have the scientific pass and also the all access pass as well.
Great. So is every session going to be recorded?
I'm pretty sure almost all the sessions be recorded.
Great.
I think what they
Amazing.
just, whatever the session is, they just push the button and gets recorded. I can't say every single one, but I'm pretty certain most of the main sessions. I don't know about all the educator sessions or the ARP sessions, but I'm pretty sure the other sessions are recorded. They have been in the past.
And then you mentioned also about networking. So you mentioned these networking rooms. Can you talk a little bit about like who's networking there? What are the themes for these networking lounges?
So there'll be 3 rooms set apart as networking areas: basic science, ARP, PEDS. The educators use them a lot, as you can imagine. So there's a lot of educators interested in a certain topic. It's meet and greet. There may be some specific basic science topics to gather interested investigators together. It's informal. There's no program. There's no media allowed. It's just discussion. So I'm actually coordinating one of the networking lounge sessions where you can come meet and greet the major editors or the editors of our major journals.
Amazing. So within these lounges, there's set times where certain groups are set to meet to discuss certain topics,
Yeah,
right?
and those will be posted as well. So you'll be able to know
Okay.
what's happening and who's going to be there. And if it interests you, come on down and get to see and actually talk to some, again, people and very informally about areas you may be interested in. And also, it's a way potentially to, expand your circle of contacts, do more research together. That's really the purpose, is just to get people together, help them connect, And then hopefully, again, one of my favorite phrases, to move the field of rheumatology forward.
Amazing. Certainly, there's people from all over the world that attend Convergence because it's such a sort of an important meeting for rheumatologists. I think over the last few years, attendance from international rheumatologists has sort of fallen a little bit because of a lot of things that are going on in the world. How are you planning to make this year's session sort of accessible and inclusive to an international rheumatology community?
Yeah, beyond the global summit, we are again offering, on demand anywhere in the world. And last year we did try to package some of it in the smaller bites as well. And I don't have the data on how well that went. So that we're trying to find ways of making this a bit more cost effective, smaller bites, more accessible. But, if you can't attend a meeting, how can you still attend the meeting? And on demand is a way to do it. It's been a very great tool. And again, the leadership is trying to explore ways of making it even more accessible and a bit more cost effective for certain people.
You mentioned an all access pass. So there's an all access pass, and then I think there's like a scientific session pass. What is the difference between those passes? One is more expensive than the other. That's what I could gather.
So the all access pass does give you access to, for example, the global summit, the review
Mm.
course, the basic
Uh,
science, the radiology boot camp, and the scientific sessions begins at the opening session. That's what you have access to, both live and on demand. There's some limitation, based on which pass you choose. And you're right, the meeting is expensive. It's pretty much in line with other major medical meetings. And, having been going to Convergence for many, many years, it has become more costly.
yeah.
I think we were spoiled when I first joined the committee in 2006. There's a lot of industry funds that were available because a lot of new medicines were coming to the market. Some of that isn't quite as proliferative as it used to be. And so places like Chicago are fairly expensive to have meetings as well. So the costs go up. But we hope that with the meeting itself, the networking that happens there, the excitement, feeling the excitement about being a rheumatologist or a rheumatology professional, and having access to on demand will really make that cost effective for you. And again, you can have as much CME and MOC as you want based on how many sessions you're able to fit in both during the meeting and after.
Amazing. So just to let everybody know, ACR Convergence 2025 is happening from October 24th to October 29th in Chicago at the McCormick Place Center. Should be an awesome session based on everything that we've discussed, Greg. I am even more excited about this year's Convergence than I was previously. It should be a lot of fun, and I really appreciate your all your efforts in every year in making sort of these meetings even better than the year before, and all the thought that has been put into making sure that attendees actually learn the material and are able to improve patient care as a result. So really appreciate your time in planning the meeting and in leading the charge of so many people, and also I really appreciate your time with me today.
Well, thank you. Make sure that I recognize the AMPC staff, Jennifer Wells and her group who do so much to make Convergence happen, and then the myriad of volunteers on the AMPC who just do a wonderful job, thoughtful job of putting the meeting together, and the staff that make it happen. So they're just an amazing group to work with, and as an educator interested in CME, this is the ultimate experience for me, right? So you get to lead your national meeting. What a wonderful experience that is, and excited to be part of it. And I appreciate you having me on.
Awesome. Greg, I'll see you in Chicago.
All right, see you there.
What a preview of ACR Convergence 2025, a program that will include artificial intelligence and next wave immunotherapy like CAR T cells, and a meeting design that leans hard into active learning. ACR Convergence runs October 24th through the 29th at McCormick Place in Chicago. Most sessions will also be recorded for on demand viewing within 48 to 72 hours. So it's important that you build your schedule and then catch what you miss later. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars or however many stars you think we deserve. You can find our show notes for this and all other episodes at acronair.org, on Apple Podcast, Spotify, and on your favorite podcast app. Until next time, get your tickets ready. And of course, stay healthy.